Are you looking for a fresh start in 2025? Body contouring treatments are the perfect way to achieve your confidence goals by targeting stubborn areas of fat that diet and exercise just can't fix. But what treatments are right for you and how do they work? Hi everyone, I'm Dr. Weinstein. I'm a board-certified dermatologist, and today I'm breaking down the top body contouring treatments to help you feel your best this year. So first things first, what is body contouring? Body contouring refers to a category of non-invasive or minimally invasive treatments that help to sculpt your body by reducing fat, toning muscle, and tightening skin. These treatments are designed to target stubborn areas of fat that are just really hard to get rid of. So abdominal fat post-pregnancy, love handles are a common area in men, also the fat that accumulates under the arms, or even the double chin. We can also use these treatments to treat unwanted fat and stubborn pockets of fat on the legs. If you've made it this far, I want to thank you for supporting this channel. Please hit subscribe so you can stay up to date with new content every week. Now let's get back to the video. Let's go over a few of the top body contouring options out there, and you'll be able to determine which one is right for you. And sometimes it's not just one singular option, it's really a combination of everything that works synergistically together. So option number one, cool sculpting. Cool sculpting has been around for the longest in the body contouring world. It's being performed in over 90 countries across the United States and beyond. It's been out for over 10 years, and it uses a process called cryolipolysis to selectively freeze fat cells and essentially kill them. So the way cool sculpting works is we apply an applicator to whatever part of the body that we decide to treat. So let's just say, for example, it's your abdomen. So we're going to apply the applicator that fits best to the pocket of stubborn fat that we want to treat in a certain area, like your abdomen, for example. The applicator attaches to the skin. It selectively freezes the fat cells, so no underlying vessels or vasculature is damaged, and your overlying skin is not damaged as well. And so over a period of time, usually it's about 35 minutes, the device will selectively cool those fat cells. And then over time post-treatment, those fat cells will die and be excreted in a normal metabolism. With each treatment, we expect to see about a 20% fat reduction, which is about a finger breadth amount, so a little less than an inch. And what we hear from patients most often is that after a series of these treatments, their clothes fit better. Now, it's important to remember that this is not a weight loss procedure, so you're not going to step on the scale and check your weight after every treatment. It's really a contouring procedure. So the best patients are those who are already on a consistent diet and exercise routine. So you have a good routine outlined, you're on a weight loss journey, or maybe a sculpting journey, and we're really helping in that process of reducing stubborn areas of fat. So that, for example, when you put on a pair of jeans, you don't have a muffin top, or if you are taking a side picture, you don't have a double chin. So the best candidates for this treatment are ones who have started a consistent diet and weight loss journey and perhaps have noticed that stubborn areas are still not budging. So that's not uncommon. In women, it's most common to see these areas in the lower abdomen. So no matter how many crunches you do or how much weight you lose, there still have a stubborn pocket of fat in that area. And for men, it's typically the love handle. So again, they're working out, lifting weights, eating properly, and just can't get rid of those stubborn pockets of fat on the sides. And so this is a really great treatment to think about to help with your overall contouring goals. And so it's not something that happens overnight. Typically, it does require a series of treatments, like I mentioned. And so we like to treat every 6 to 8 weeks or so if we're really targeting a specific area, just knowing that the final results won't be appreciated until about 3 months after your last treatment. So if we're taking before and after pictures, that's typically when we take them. So as you've probably gathered, this is a treatment, and really any of the body contouring treatments are treatments you should plan for. So if you're planning a wedding or a spring break trip or somewhere where you really want to look and feel your best, this is something we need to start months in advance to help prep the body to achieve our goals. Now, I also should say that short-term goals are great, and if it's going to get you to where you want to be, feeling confident, and your clothes fitting better and everything looking nice and contoured, that's great. But in the long term, we should think about how do we want to look and feel, 5-10 years from now, and make sure that the practices that you're starting are sustainable. And so I look at cool sculpting and a lot of these body contouring treatments as sort of a kickstart to that long-term thinking of taking care of your body, getting enough exercise, getting enough sleep, and eating properly. Now, the next treatment we can think about is something called Sculpt. So remember, I said body contouring also involves toning muscle. Sculpt is a device that helps to not only reduce that fatty layer, but also tone muscle. It's perfect for getting just the right definition to your abs or glutes. And it can be used in combination with something like cool sculpting, but often these treatments are closer together, so weekly or every 2 weeks for a series of treatments, and then you take a break. So we've covered options for reducing fat and toning muscle, and now with skin tightening. And the next step would be to tighten skin. So often just reducing fat and toning muscle is not enough because a lot of women post-pregnancy, for example, still struggle with loose and saggy skin. And so if that's the case, you've lost your fat and you've also toned the muscle, but you still have some loose, saggy skin in that area, we can employ techniques with radiofrequency or ultrasound to help tighten the skin. Now, these are both devices that use heat to help stimulate collagen and elastin with an overall goal of tightening the skin. And so they can be used in combination with something like cool sculpting or Sculpt to help with that overall improvement in body contour. In our practice, we use a device called SoftWave, which delivers ultrasound waves at a depth of about 1.5 millimeters under the skin. So it really targets that deep dermis where our collagen-producing cells live in order to stimulate collagen and also elastin, which adds to that bounce back of tissue. All of things that we lose, unfortunately, as we get older, leading to the appearance of saggy skin. Now, I mentioned this a little before, but really, who is the perfect candidate for these treatments? Body contouring is perfect for people who are close to their ideal weight and really want to contour and sculpt specific areas of the body. We can also use procedures like cool sculpting and Sculpt to give patients that kickstart into their weight loss journey. And often it is a motivator. So once people come in for their first series of treatments, they'll continue to come in and then continue on their weight loss journey. It's not a substitute for weight loss, but it's an excellent complement to a healthy lifestyle. All in all, exploring body contouring can be an excellent restart. Body contouring can be a game changer as you set your 2025 goals. If you're curious about what treatment is right for you or where you should start, make sure you schedule a consultation to create a customized plan. As I mentioned, a lot of these treatments can be combined and really work synergistically together. If you found this video helpful, don't forget to like, comment, and subscribe for more science-backed skincare and aesthetic tips. Thanks for watching, and I'll see you in the next video.